Hello and welcome to Ask the Doc, No Appointment Needed, the show where the health questions that you send in get answered by experts in the field. I'm Julie Donaldson, and today we're going to discuss dealing with PTSD. And for that, we are joined by licensed mental health counselor, Dr. Rachna Buxani-Mirpuri. Dr. Buxani, thanks so much for joining us today.
Thank you for having me, Julie. Pleasure.
Now, many people suffer from post-traumatic stress disorder or PTSD, and some don't even know it. Anyone can experience PTSD after a potentially traumatic event, but people who have previously experienced traumatic events, they are more susceptible. On today's show, we will take a closer look at helping people manage PTSD as well as answer your questions. All of that and more coming up on this episode of Ask the Doc, No Appointment Needed.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, we have a lot of great topics to get to today, so let's get straight to your questions. And our first question comes from Rania, who writes, I was in a car accident last year when I was sideswiped while sitting at a red light, and now I tighten up anytime that I stop at a light. Is this normal, and will it be like this forever? Now, Rania, thanks so much for your email. Dr. Buxani, I know many people have had similar incidents, and it can be very jarring. Is this a form of PTSD?
Absolutely. It could be. Rania, thank you for sending in your question. And I can just imagine how difficult this is for you. So hang in there. I'm going to try to help you as much as possible. PTSD after having suffered a car accident is quite common. Some of the symptoms, and you've described those, the hyperarousal, the avoidance. I mean, I've had some clients who just won't drive after that, right? So the avoidance of the trigger situations, the intrusive thoughts that can come back as flashbacks, as nightmares. So all of that, all of those symptoms are a part of PTSD. What can you do to help yourself a little bit? Remember, there are a lot of really, really great therapeutic techniques now that specialize in dealing with trauma. So there's trauma-focused cognitive behavior therapy. There is EMDR, which is more of a sensory technique, works miraculously for so many people. And my personal favorite, IFS, which is internal family systems, that also helps deal with PTSD and trauma. There are a lot of support groups. So you may want to look and see if there are any support groups in your area that you could attend. But there are support groups for people who've been victims of car accidents and thus then developed PTSD symptoms. Again, encourage you to look at that. And self-care, right? Taking care of yourself. And I can never talk enough about that. And when we talk about self-care, I think people, they think about, oh, I have to exercise and I have to eat right. Yes, but that's self-care for your body. Remember, we need self-care for my body, mind, and soul. So just make sure that those elements are included. Things like meditation, things like journaling, grounding techniques, all of those are actually very, very helpful in dealing with a situation like you're having to deal with, where you're in the car and you're finding yourself stuck. Hope that helps, Rania.
Is it also a matter of just continuing to do this? Can each time she drives, as she continues that process, make it maybe easier?
Absolutely. What makes it easier, Julie, is knowing what to do. I feel like a lot of us get stuck because we're fighting the emotion, right? Because it doesn't feel good when I feel that. So what I'm trying to do is I'm trying to fix it. I'm trying to get to a place that I don't feel that anymore. And I can't necessarily do that. I can't control. What I need to do is be able to manage. So a lot of these grounding techniques, if I teach myself some of those, when I do get triggered, when I'm at the stoplight, I can use those grounding techniques to relax my body. And what happens is, once my body is relaxed, because this part of my brain, calms down a little bit, the fight flight one, and the prefrontal cortex kind of lights up and says, oh, okay, don't worry, this is not a dangerous situation. I don't need to panic. That's when the panic stops, right? So the grounding techniques are almost like a precursor for our thinking mind to kick in and for us to then relax.
Okay. Well, we have a lot of questions to get to, so let's keep going here. This
Okay.
next question comes in from Althea, who emailed us and asks, I am a parent of 2 young kids, and ever since the school shootings at MSD in Parkland, I'm afraid to let my kids go to school. I worry about it at night, and I don't put my phone down all day in case either of them just tries to call me. I just can't stop thinking about it. Dr. Buxani, Althea is not alone, but before you do answer her question, let's take a look at this short video on some of the symptoms of PTSD.
Symptoms fall into 3 categories: intrusive memories, such as recurring, distressing memories of the event, flashbacks or nightmares, avoidance, such as not thinking about the event, avoiding situations that remind you of the trauma, or leaving situations because you feel anxious. Another category is changes in physical and emotional reactions, such as being easily startled or frightened, an increase in drug or alcohol abuse, having trouble sleeping or concentrating, becoming easily angered or having aggressive behavior, experiencing overwhelming guilt or shame, or having negative changes in thinking. PTSD is different from stress or trauma. It doesn't go away with time or self-care. It affects your ability to function and enjoy life. If you are experiencing PTSD, you are not alone. 6% of the population will experience PTSD. 12 million adults in the US have PTSD annually. 8% of women will develop PTSD versus 4% of men. The good news is PTSD is treatable and recovery is possible.
So, Dr. Buxani, those numbers can be quite startling, and I'm sure they're changing all the time. Can you talk to us a little bit about what Althea is dealing with?
Of course. What research has found, actually, Julie, is that psychological impact of school shootings extends way beyond the direct victims, right? And we've actually found, what studies have found is that parents experience heightened anxiety and depression when there is a school shooting. So, this is very common. I'm a parent myself, and I know every time there's a school shooting, I'm worried about sending my kids to school, right? So there's a lot of studies that point out to that. What can she do? One thing, again, don't try to control. A lot of us try to control the way we think, and that doesn't necessarily work, right? What we need to learn how to do is manage our thoughts, not control our thoughts. And the way to do that, again, is in mindfulness techniques. And what mindfulness teaches you is to live in the present moment, to accept that I can't change events that are beyond my control. So some of the mindfulness techniques are beautiful in trying to help us manage these, anxious thoughts. And of course, listen, if things are unmanageable, reach out to a professional who can help you cope with anxiety. I think that's one of the foundations of us therapists, right? So anxiety, depression, mood disorders. So if you, Althea, feel that okay, this is going beyond something that I can manage, please reach out for help and seek professional guidance in managing the anxiety.
This is unfortunately something we deal with all too often in today's society of shootings at schools. But I think it's also important to say that, you don't want your kids to suffer through this as well. How do you have those conversations so that they're not feeling the trauma from that potentially?
So I think, unfortunately, Julie, I think we've come to a point where kids are getting, and this is not a good thing, but they're almost getting desensitized to listening about these incidents has happened too much. And yes, they're happening way too much. But if your kid, you feel is acting different or, is distancing themselves, detaching, which could be some signs of PTSD or having to deal with trauma, please reach out to them, take cues from your kids and figure out from them what they need to be able to manage the situation. And again, if you feel that your kid could benefit from professional help, then please reach out to a child therapist, to someone who works with teenagers, and they will help you navigate the situation.
Yeah, it's so difficult. And it's just important, I think, too, to make sure that you don't go at this alone, to allow those fears and the trauma to continue on here. Here's our
Yes,
next
I
question.
agree.
It comes from Ron. He emailed in and asks, I have heard people mention the terms big T and little t when it comes to trauma, but what is the difference between the two? Now, Dr. Buxani, can you tell us a little bit more? Because I'm not even sure I understand the difference between the big T and the little t.
So I just want to say, Ron, I love your question. Thank you for bringing it up. And this is the reason why, because yes, there are a lot of people confused. So let's talk about the word trauma, right? So trauma comes from Greek, so the origins of the word trauma are from the Greek language where it means wound, right? So, and when we think about a wound is painful no matter how big or small it is, right? So let's talk about the big T's and the small T traumas. Your big T trauma is that major life-threatening event that happens, right? So natural disaster, accident, war, physical assault, sexual assault. So those are your big three traumas. They're sudden, they're intense, and they result in an immediate psychological distress. What about the little t, which we are seeing a lot of, right? So little t is chronic, repetitive stress that damages your mental health. Examples of those include a parent who's constantly negating you or putting you down, bullying, relationship stresses, right? These little t traumas have a significant impact on your sense of self and well-being, and also in how you relate to the world. In fact, Peter Levine, who is one of the stalwarts in the field of trauma, actually talks about how even the little t traumas, in addition to the big T traumas, lead to a loss of connection to self, family, and society in general. So it's very important for us to understand the little t traumas and understand the impacts of it, so that when someone presents with, hey, you know what, I was emotionally abused by my parent who kept putting me down, we don't discount that as not being trauma, because it is. And it's chronic, it's pervasive, and it's actually extremely damaging.
And then when you know the difference between the two, it helps you with the plan going forward, which we have more questions that kind of go to that as well. But we still have time for you to get your questions in as well if we haven't got them in so far. Real easy to send them in. Check this out.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
We've already had a lot of great questions. Let's continue on here with this. The next question comes from Arnold. Ever since the pandemic, my mom is really afraid of getting sick. Her sister got COVID and became very ill, and she is still taking care of her to this day. Now, we never thought it could be PTSD, but what can we do to help ease her mind? Now, Dr. Buxani, I think all of us can agree, COVID-19 pandemic, it got to a lot of us and traumatized so many. So what can Arnold do here?
I agree with you, Julie. Arnold, thank you for writing in. And yes, the pandemic was really, really rough on so many of us. And things that you can do, Arnold, to help. First of all, your mom has found herself in a very difficult situation, because obviously, I'm sure she has her own stuff with COVID-19 that she's dealing with. But then now she's found herself in a situation where she has to be the primary caretaker for her sister, which is, comes with its own heartache, right? And very, very difficult to manage. The first thing is what you're doing right now. You're reaching out, you're trying to educate yourself, you're trying to learn about the signs and the symptoms of PTSD. So kudos to you. Thank you for being here and making yourself aware on what this looks like. Listen to your mom and offer support without judgment. And the without judgment piece is very, very important. You really want to go at this very, very mindfully, because we are not in her shoes. We don't know exactly what she's experiencing. Just let her know that you're there to support her, because this is challenging. Offer help if you can to take care of her sister, because anytime that she can actually get to take care of herself and recharge her battery is going to be extremely, extremely important to her. Be patient with your mom. There might be times that she's, she might snap, she might be tired, she might be, she might get a little aggressive, but just know where it's coming from. Again, the situation that she's found herself in is far from easy. Let your mom take the lead in asking for help, right? So ask her what she needs, and take her cue and offer support accordingly. These are some ideas, Arnold, as you help your mom navigate something that I consider an extremely difficult situation.
Nobody knew how to handle this, and many are still dealing with it just so many years after. So a lot of great tips there. I think we can all take to our dealing with it and recovering as well. Leo is the next one that has a question for you. And he says, Dr. Buxani, I've been listening to you and am fascinated by the connection between the mind and the body when it comes to trauma. So how does that actually work? Well, Leo, thanks so much for your feedback there. Dr. Buxani, can you explain a little bit more between the mind and the body that Leo mentioned?
Sure. I'm going to start with pointing out some research, because I think this is going to illuminate more this mind-body connection. And first of all, thank you, Leo. Great question. There is a lot of research that actually points out to trauma being a result of or resulting in autoimmune disorders, right? Like rheumatoid arthritis, MS, lupus, inflammatory bowel disease. There's just a lot of research, and that research is growing as we speak, about just how much trauma can result in these autoimmune disorders. Studies have shown a very strong association between breast cancer and certain personality traits. What are those personality traits? People who, women who suppress anger, who don't, address their feelings, who don't heal from, traumatic experiences. And again, they don't heal from it because that personality does not allow. There's a very strong correlation between those personality types and breast cancer. Finally, there have been studies that have shown a very, very strong correlation or causation between women who have ovarian cancer and have had trauma, right? So in fact, what studies have found is that women who have experienced trauma are twice at the risk of developing ovarian cancer. So this is a little synopsis of studies that have actually found that connection between the mind and body. How does that work? Let me explain. We experience stress. Stress can be acute or stress can be chronic, right? The acute stress is okay. If someone, crosses my boundaries, right? I experience anger in the moment, and that's okay, because something just happened. I felt violated. I experienced anger. If I found myself in a dangerous situation and I experienced fear in that moment, that makes sense. So those are acute stresses. Then we have what we call the chronic stress, right? So this is something that's debilitating. It's long-term. It goes on and on. It could be because of relationships. It could be because of, some trauma that's, those little T traumas that are going on in my life, or, that's just a work situation. Maybe I have a boss that's narcissistic and I'm in a very toxic work environment. So those chronic stresses, what they do is those stress hormones, but when that stress releases the stress hormones, and when I'm living with those stress hormones for a long period of time, they end up suppressing my immune system, thus then encouraging cancer cells, right? So that's the mind-body connection. So if there are situations that are causing stress in my life, and especially that chronic stress that's going on and on and on, I do need to separate myself from those situations, whether those are relationships or whether those, like I said, environments, whether it's work or home environments. Because if I don't do that, that then is going to result in me developing probably a terminal illness.
It's so fascinating, and you can physically feel it. Your heart will race, maybe your throat gets dry when you're under stress and you're feeling it, and just how the body and the mind really is connected. And it's important to recognize that as something that you need to address and deal with. Like, these questions are so great on how we can kind of manage this. And for those that, maybe you didn't get time to get your question is, well, there is still an opportunity for that, to have your question answered. Just go to our website and click on Ask Hanna, where nurses are available to help. Here's some more information.
Looking for a fast, free, and convenient way to get expert health advice? Ask Hanna. Ask Hanna is your go-to telemedicine service provided by the Health Channel. Whether you have questions about your health, need advice on wellness, or want to know more about medical conditions, Ask Hanna has you covered. From the comfort of your home, you can chat live with a health advisor, check your symptoms, and learn possible causes, and browse through a library of health articles. So why wait? Visit askhanna.tv today and take control of your health with Ask Hanna. Your health, your way, anytime, anywhere. Ask Hanna, your trusted health companion.
Now, our next question comes in from Andres, who writes, I had a traumatic experience a few years ago, and I can't help but think to myself, why did this happen to me? Now, is that normal, and how can I stop thinking like that? Dr. Buxani, is that a common thought process? And if so, how can people get over it?
It unfortunately is, Julie, because there's, when something bad happens to me, there's a concept of unfairness, right? Like, why did this have to happen to me? So unfortunately, yes, a lot of us do experience these thoughts, and feeling stuck in that unfairness kind of gets in the way of us actually processing the event, so processing the trauma, and kind of gets us stuck or trapped in the past versus moving on. My advice to you is to honestly work on radical acceptance, right? It's very important for us to get to a place where we can be okay with what happened, knowing that we had no control over it. So not that the event itself was okay, but the fact that it happened and it does not need to hold me back, I can actually move forward. So practicing radical acceptance is very important for us to be able to move on and heal from those situations in our life that really are distressing. Else, like I said, we feel stuck. But also practicing radical acceptance with compassion for self, right? So I want to make it clear, because I have some clients who, they've been in relationships and haven't, maybe in toxic relationships, they've gotten to a point where they've accepted that, okay, fine, you know what, this happened. It was not fair the way he treated me or she treated me, but okay, I get it that it happened. And here I am moving forward. But then they get triggered at some point and they can't understand, and they'll come back to me and say, Dr. Buxani, but I have radically accepted. Why am I still feeling hurt? Or why am I still feeling angry at times? Well, because you're human, right? So radical acceptance does not mean that I'm not going to experience emotions. If I do get triggered, offering that compassion to yourself that I will experience that, but also, telling myself that it's okay. It happened. It doesn't need to define me. I can move on. And the extreme positive or end of radical acceptance is actually figuring out purpose and meaning from an incident that happened. But that's a goal to work on. But in the immediate, to start focusing on working on that radical acceptance.
That is so powerful, to recognize that. And one thing I always say is, you go through any of this, sometimes you just got to be easy on yourself, give yourself a little bit of grace as you're going through.
Absolutely. Yeah. And that's where the compassion piece comes in. And that's for everyone who's ever experienced trauma. Please allot and allow yourself compassion. That's the most important. And IFS, which is a technique that I tend to use a lot, is the basis of IFS is compassion. And that's why I feel it's so important. And again, I think these questions are amazing.
I mean, it's just such a big topic, and you realize so many people are dealing with a lot of things in life. And I think your biggest point here was to recognize that and then to go seek help throughout it. There's so many questions we didn't get to, but Dr. Buxani, thank you so much for your time today, an incredible insight. And just thank you all for joining us and sending in some really important questions. I'm Julie Donaldson, and we're going to see you next time on Ask the Doctor. No appointment needed. Stay safe and be well.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Looking for a fast, free, and convenient way to get expert health advice? Ask Hanna. Ask Hanna is your go-to telemedicine service provided by the Health Channel. Whether you have questions about your health, need advice on wellness, or want to know more about medical conditions, Ask Hanna has you covered. From the comfort of your home, you can chat live with a health advisor, check your symptoms, and learn possible causes, and browse through a library of health articles. So why wait? Visit askhanna.tv today and take control of your health with Ask Hanna. Your health, your way, anytime, anywhere. Ask Hanna, your trusted health companion.